Good evening and welcome to News 24's The Editor's Table, your regular update, where we help you understand the burning issue of the week, the burning issue of our time at the moment. And with so much happening in South Africa at any one time, it's hard to keep track of exactly what are the burning issues, what are the burning developments behind some of the big stories developing across our country. And that's where News 24 comes in, and we bring you the editor's table regularly for our subscribers, and you can interact and send us questions as well. Register for it when they come out. And that's just one of the great perks of being a News 24 subscriber. But if you're not left out of the conversation as well. You can still keep up with the in-depth knowledge that we bring you through our YouTube channel as well, and you can follow it on that platform. But that's enough on that. Let me introduce tonight's esteemed panel. We've got a lot to get through. I'm Sheldon Morais. I'm assistant editor for Fast News at News 24, and I'll be facilitating our discussion this evening regarding vaccine hesitancy. And are we heading for a catastrophe? Now, that may sound hyperbolic to you, but once you hear from our panelists, and it may well turn out to be hyperbolic based on developments today, but you'll get a better understanding of the vaccine hesitancy and the rate of vaccinations that South Africa is facing. And let me jump straight into it and introduce you to our guests this evening. First up, Nathan Geffen from our partners, GroundUp. He's the editor at GroundUp, doing work, as the name suggests, from the ground up, telling stories of ordinary South Africans on a daily basis. Then we've got Tammy, Petersen, senior journalist at News 24, who's been having a look at vaccine hesitancy, the real issues, the real people at the coalface who may have been hesitant and no longer are hesitant, and for whatever reason have decided to take the vaccine. Senior journalist in our Johannesburg office, Tebogo Monama, who's been following developments around COVID very closely for over a year now. The ins and outs. If there's anyone who knows anything on the news front, it's her. And then we've got Bevan Lekay, our Health 24 editor, who, similar to Tebogo, has been following the developments, quite closely around COVID, has a real good understanding of the scientific developments, what the vaccines are, why you take a vaccine as well. So together, we hope to bring you a clearer understanding of South Africa's, the state of our vaccination program, the state of vaccine hesitancy. What do some of the surveys show? What do some of the numbers show? And what are some of the personal stories as well that, these journalists have been hearing, have been covering as well? And let's make it clear. I think, over the past couple of weeks, News 24 has been bringing you stories around vaccine hesitancy, from people on the ground, their personal stories, people who at once were hesitant, in fact, were resistant to taking the vaccine and have had, those opinions changed, have subsequently taken the vaccine, or have decided to take it and will do so in future. And the science broadly speaks to the safety of the vaccines and that the vaccines work. But let's jump into it. If you'd like to contribute to this and you're following us on following the webinar on Zoom, you can use the Q&A function. Pop your questions. Let's help you understand the stories and the developments around COVID-19 and the vaccine even better. Clarify any misconceptions you may have, or even questions that you may have. We'll learn in the process. I think it's been a learning for all of us over the last year and a half. As this develops, we're learning with you. And what we want to do is have a discussion around that will leave you better off and have a greater understanding of where we are at the moment. So let me first start on the basics. I mean, let's not assume what a vaccine is. Bevan, I'd like to start with you. And just roughly, I mean, what is a vaccine?
Well, look, if we look at COVID-19, obviously we initially start with the virus, SARS-CoV-2, and then potentially you get the disease, COVID-19. And what the vaccine does is going to give you a level of protection against severe illness and also potentially death, because what we've obviously seen with COVID-19 is there's a relatively high death rate and also severe illness. And we've also got things like long COVID, which is terrible. You know, people who suffered from COVID-19 and then further had long COVID, and it could be anywhere from 3 to 6 months. So the idea is the vaccine is going to give you some level of protection to avoid you having to have either long-term symptoms or a severe case of COVID-19 or potentially die from the disease. So it's all about giving yourself an extra level of protection over and above your potential, your normal immune system and natural immunity. And that's why it's important to get vaccinated.
So Bevan, just to be clear, the vaccine is not going to stop you from getting COVID-19. It's going to protect you if you do contract it.
That's correct, Sheldon. I mean, the idea is to up your level of protection. The studies have shown that in some cases it does lower your risk of contracting it, but it's never really going to stop you from getting COVID-19. But I mean, this is also why there are non-pharmaceutical measures in place. You still distance, you still wear a mask, and so even beyond getting your 2 shots, in the case of the Pfizer vaccine, and obviously 1 shot with the Johnson & Johnson vaccine, people should still wear masks. People should still, distance, but knowing that you actually have this level of protection now that you have from a vaccine.
And at certain points, I'm going to stress, some of the comments that we make, because what we're going to get to is that communication around this is so key. Helping people understand in simple English, there are a lot of medical terms, there are a lot of scientific terms, COVID-19 in and of itself, coronavirus, these are all scientific terms. And one shouldn't forget, what that barrier, that communication barrier sometimes, does in that journey of hesitancy. But Tebogo, turning to you, you've been following, the COVID-19, the developments around it as well. We had the trials that came out. We had updates from medical experts and the like. That was pre the rollout of the vaccines on a mass scale. Now that we've got the vaccines rolled out, what practical, what real evidence is there that the vaccines are indeed working?
Thank you so much, Sheldon. I think one of the realest examples that's showing us that the vaccine is working is what's happening in Limpopo right now. The MEC of Health in Limpopo, Dr. Poppy Ramatuba, spoke to us yesterday, and she told us that since the 3rd wave started, no vaccinated healthcare worker in the province has died from COVID-19 complications. In the 1st and the 2nd waves, they had a few people die, but since they vaccinated the majority of their healthcare workers, they haven't had anyone die.
I mean, that's really an important point to make. Nathan, building on that, you and your team have obviously had a look into not only at stories, as they emanate and come from the ground, focusing on the people in this instance. You've also had a look and done work with scientists in terms of, what does some of the scientific elements of it show, looking at death rates and the like. When it comes to the vaccines, in a way, would you say that they have shown and are proven to be safe?
Oh, absolutely. There've been tens of thousands of people in the vaccine trials. These are huge, well-conducted trials by some of the leading medical scientists in the world. And at this point, over 4 billion, there have been over 4 billion doses of the various different vaccines administered across the world. And in Europe and America, and even in South Africa, there are very, very good monitoring systems. to see what kind of adverse events, what kind of safety issues there are with the vaccines. And we can say, look, nothing is perfectly safe. You can cross the road and you can look left and right and still get knocked over by the guy driving the Ferrari at 200 k's an hour. But the vaccines are very, very safe. The risk of being hospitalized or dying after taking the vaccine itself it's so small. You actually need statisticians to be able to detect it. Whilst the risk of dying of COVID is high, we've already had well over 200,000 people die of COVID in South Africa. At this point, I'm not aware of if there's even been one death that's been definitively linked to the vaccine. I know people will turn around and say, hey, but the government official figure is much lower than 200,000. But that figure is wrong. That figure only takes into account people who have died of COVID in hospital and their COVID is confirmed. The much more reliable statistic comes from the Medical Research Council, comes out every single week, and it's called the excess deaths. And we're pretty sure that at least 200,000 people in South Africa at this point have died of COVID since May last year.
Now let's focus on that figure. And you raised two important points. One is around the deaths and the vaccine, right? And I specifically say deaths and the vaccine because at this stage there's no evidence that shows that vaccines cause death. And I want to be very clear about that. So Tebogo, I'm going to come to you in a bit as well. But to focus in on that 200,000 figure, we're often faced with so many figures, especially with something like COVID-19. We've got the daily numbers updates. What are the active cases? What are the total cases? How many people are recovered? How many people are hospitalized? That's quite a lot to take in. But that number, that 200,000 number, I mean, we can't let that go. I mean, that those are lives. Those are South Africans who a year and a half ago were alive and today are not. Tebogo, you've also had a look at those excess death numbers. How does it, please explain it to our audience. What does the excess deaths mean? I mean, it may, is it, there are no, deaths which aren't excess. Every death, is the like. So help us understand that terminology and what it exactly refers to and how it links to COVID in this context.
Okay, thank you so much, Sheldon, for that. I think in terms of the excess deaths, so they look at numbers of natural deaths or in any given year. So they would say that in 2018, we had this many people who had died of natural deaths and this many people who had died of unnatural deaths, whether it's accidents, whether it's murder and things like that. And then we look at what's happening now with COVID to say, okay, so we have so many people who died outside the usual numbers. Can you hear me? I think my sound is a bit bad. Yeah, so you have other people who have died just outside those usual numbers, and we don't know what to attribute those deaths to. So in this case, some of the people we might think, okay, these people died of natural deaths, but they were COVID related. So that's why the HSRC collates that data every week. And going back to what Nathan said about SAPRA not being able to link deaths to COVID, to the COVID-19 vaccine. So they investigated about 29 deaths so that were reported to them. And of the 29 deaths, they found that 6 of the people died after getting the vaccine because they had tested positive for the virus. So maybe the people did not know that they were positive for the virus when they went for their vaccine, and then they later died because of that. And about 5 of the deaths, they could not link. They could not determine what happened to the people because either some information was missing, whether their ID numbers, whether their names, or those people maybe were buried before SAPRA could do their investigations, and then the rest of the death they could not link them to the vaccine.
Okay, that's an important point that you make. I mean, SAPRA acted really quickly. So there were suspicions that, you know, these were people who had taken the vaccine and then later died. Those two events not linked at all. They just happened to happen. So causation and correlation. And SAPRA actually moved on that quite quickly. They mentioned it in Parliament, and less than 2 weeks later, you know, they were able to confirm their findings on those deaths, which I think was important because, you know, in the battle for the hearts and minds of people who are undecided, you know, that type of statistic or that type of topic was being used by people who, you know, for all intents and purposes are called anti-vaxxers and take a stance and have taken a stance where they promote, you know, not taking the vaccine. And I think we need to separate those two groups. There are people who are generally hesitant and generally unclear about what the vaccine means, what it would the impact it would have on them, and people who are committed to a messaging that says don't take the vaccine. Those are two very different sets of people, and we'll discuss that as we go on, because it's part of the complication around this. Now, Tammy, to come to you, you know, we've spoken about the numbers. You know, Nathan and Tebogo mentioned the numbers. A lot of the work you have done has been around the people who make up those numbers. You know, going back to the beginning of COVID, you've had a really hard job in and of, you know, in its own way, in terms of speaking to bereaved family members, you know, who've lost loved ones suddenly. What has been the real impact, you know, the human impact to those numbers that Nathan and Tebogo mentioned?
I think I can't even off the top of my head remember just one of those horrible stories that we had to write. It was devastating. You know, in the beginning, the numbers were sort of, you know, 1 today, 2 tomorrow, 3, and then they just picked up so much that it was actually became impossible to keep track of how many people have died. You know, in the beginning, it was sort of, we would try to find the family and, you know, get the details of the story, but eventually it became so much that there were just too many to give that sort of coverage to. I think with the vaccine and the coverage that we're giving this, particularly the hesitancy issue, I think what we're trying to do now to give a human face to this issue, because this, I think, is an enormous issue, because I think that telling the story of the anti-vax or vaccine hesitant person on the street has proven so powerful. You know, we have, for example, just this week, we have had Tammy Peters from just outside Stella, who's now dependent on an oxygen machine to help her breathe. You know, she traveled from the West Coast 2 months ago, a healthy 68-year-old, you know, taking no chronic medication, and who enjoyed exercising with her husband, healthy as a horse. She came to the Cape to celebrate the grandchild's birthday. Now, she contracted COVID and was hospitalized for 5 weeks and now can't speak for extended periods because the virus caused such extensive damage to her lungs, okay? She was an anti-vaxxer, and, you know, after reading messages and social media posts claiming that the vaccine was made from fetuses and causes paralysis, and after spending all those weeks on high flow oxygen, you know, seeing the reality of what this virus can do to you and seeing what it was doing to the patients around her, she came to the realization that there was something that she could have done and ended up not doing, which could have made that she wouldn't have ended up in hospital in the first place. Now, Tanny Elise messaged me earlier today. I just want to share this story, just made my day. She messaged me earlier today to say that she had gone today for her first jab. She was at the Stella Clinic this morning. She has had absolutely no side effects and feels as good as she did before she was inoculated. You know, and she felt it was very important for her to share her story, because just like everybody else who is vaccine hesitant or is anti-vax, she was the same way just before she contracted it herself. You know, she felt so strongly about it that even though she's a shy retired farmer from Stella who didn't particularly want everybody to know who she is, but she felt so strongly about it and wanting to give a human face and help people understand how how devastating this virus can be, that she just put herself out there and said, if people want to knock it, that's fine. But, this is an important issue and it's something that she wants to speak about. And she shared her published story with all her friends, many of whom have now decided to go for the vaccination themselves. How amazing is that? Tanny Elise, the retired farmer, made it a mission to spread the word about how devastating COVID can be. I mean, there were many other human faces that we have put to this sort of issue, to the anti-vaccination and issue. We have had Priscilla Potgieter, who is a mom of two from Utenaid, who just a few short months ago also, saw COVID as just a cold or, an over-exaggerated pandemic. And that was until people close to her started dying. The healthy people, like her cousin, Dougie Heymans, he was a former Cheetahs prop. And she asked such a pertinent but simple question. If we can do something to minimize the severity of the virus, why on earth wouldn't we? I mean, these are just two examples of many stories we've covered of people who, looked at the facts, the statistics, and realized that, the choice they made wasn't maybe a particularly sound one. And I think that reading the stories of people like Tanny Elise and Priscilla from Utenaid is important. It's from the mouth of people like you and me. It explains how they came to form their anti-vax opinions and how they realize that that is maybe not the best opinion to have. Read them. I respect people's right to choose to be vaccinated, but please, we have to base that choice on facts, not a voice note recorded in a kitchen in Lansdowne by someone who doesn't even know what messenger RNA is. I mean, read from reputable sources, listen to the science, ask questions, but don't come to conclusions without looking at the bigger picture, because you're doing yourself and the people who care about you and who you care about such a great disservice.
That's very important, Tammy. And I liked one of the, drawing from your story where, she had such a, it may sound so simplistic, but, her advice around you saying, you've got a brain, the ability to think and question, which I think saying now, and she, where she says, who wrote that it's bad, on what authority, was it verified by people with knowledge? Now, Bevan, we're going to come to that because it's not as simple as that, but what she says rings so true, and the who knows the lives that she may have saved. As you mentioned, her friends now may have changed their minds and are now going to be vaccinated. But before we move on to some of the communication, the vaccination, the issues underlying the hesitancy, Nathan, let me come back to you. You wanted to make a comment about around the deaths.
Well, I just one of the things you've got to realize is that about 8 million people have already received a dose, at least a dose, of one of the two vaccines in the country, the Johnson & Johnson one or the Pfizer one. That's 8 million out of our population of 60 million. Most of those people are over the age of 60. People die every day in South Africa. And obviously, some of those 8 million are going to die just in the normal course of things. That's just part of the process. It would be a great mistake to think, because people have died and they got vaccinated, that it's because of the vaccine. The vaccine only protects you against COVID, hospitalization and death. It doesn't protect you against other kinds of death. So there's no need to panic every time you hear of someone who's been vaccinated and who happened to have died. Almost certainly they would have died anyway, because the vaccine is extremely, extremely, extremely unlikely to kill you.
Nathan, and that's it leads us to a great point. You mentioned, the amount of people who've been vaccinated. Before we get to that point, GroundUp has done some stellar work around, the older cohort, some of the first groups who were vaccinated, and their messaging to the youth. I mean, that really struck me. I mean, before we'd come into this pandemic, if you had said who would get this, I would not say that it would be older people who live in rural areas. Yet those are the same people who are voicing and saying to the younger cohort, and we see evidence that amongst the younger cohort, there are people who are, you know, hesitant and say, oh, I'm going to wait it out. And maybe it's the, you know, they've got the lack of youth behind them still. But, you know, I was struck by some of that reporting, you know, the older people saying, you know what, go out, look at me, I'm fine. I've taken this. And that really struck a chord with me.
One of the most amazing things to me is that I think it's Limpopo, if I'm not mistaken, and someone can correct me if I'm wrong, it's Limpopo province that has the highest vaccination rate at this point, a deeply rural province. That's really promising and wonderful news, and it shows that we can get this out to rural areas. And perhaps maybe one of the blessings for many people in Limpopo is they probably have less access to some of the nonsense on social media that's going around.
Listen, that may well be the case. I think, you know, Limpopo certainly being a shining example. Let's get back to you, Tebogo, in terms of how we came about, you know, the vaccination drive. You know, we had the tests, we had the trials, you know, we had the healthcare workers being vaccinated. Then, you know, sort of it opened to other groups. We had teachers and the like. Our vaccination process didn't get off to the easiest start. And I mean, I suppose you could say in typical South African fashion, there was, you know, recrimination, there was outcry from many groups, rightfully so as well. There were concerns around government's efforts to get vaccines. Did we move fast enough? Were we too slow? Then there were vaccines that we had sent back, and, you know, it got off to a slow start. Why was that exactly? Just briefly.
So I think one of the reasons that it got off to a slow start is because of vaccine availability. In the first half of the year, there were not enough vaccines available in the market. And we remember what happened with AstraZeneca. We got it from the Serum Institute in India, and then it was found that it was not efficacious enough against the variant that was circulating in the country at the time, and we had to donate the doses to the African Union. So that meant that we had to wait a bit to get our vaccines. And when we then had to get the Johnson & Johnson, after the Sisonke trial, when we had to get the Johnson & Johnson for the general rollout, there were issues with contamination in the US. So that also put us on the back foot a bit. But then now I think we have we have enough rotation of vaccines in the market. But the issue is we don't have enough people who are going out to get vaccinated, you know. And I was speaking to the head of the EVDS system, Dr. Nicholas Crisp, and he was saying that they're opening up for the 18 plus cohort from tomorrow to get vaccinated, because they take up from the 35-year group cohort has been very slow. So the first couple of weeks, everyone was going to get vaccinated, everyone was excited, but now that has tapered down. So vaccination sites are sitting empty. So, but what he was saying is they expect the same thing to happen with the 18-year group cohort, that they will go in numbers and then the numbers will go down. So what he was saying is that government needs to come up with strategies on how to get the vaccines to the people. So maybe let's stop having these big vaccination sites. Let's actually go out into communities, go to people's workplaces. The same thing that is happening in Limpopo, right? So Limpopo is going into communities, is doing door-to-door awareness campaigns to make sure that people come out. They're speaking to church leaders to encourage people to get vaccinated. And the other issue that the Limpopo province raised was that with the younger age groups, it's hard to get to them. It's hard to speak to the community leaders and the religious leaders to say to them, encourage them to come get vaccinated, because young people think, oh, we know everything. They say, oh, we read, we know that vaccines have side effects. So we're on social media, we're seeing all of these things. So there is a lot of misinformation in the younger age groups. So I think that's one of the things that government will have to fight for in this term of rolling out vaccines.
Bevan, talking about government strategy, I think, you know, government strategy needs to be placed against the circumstances that it needs to face, you know, because that will determine what strategy it takes. Now, we've spoken about anti-vaxxers, you know, we've spoken, you know, misinformation. We know that in the age of social media, it's WhatsApp voice notes, it's the, you know, YouTube channels, there's Facebook. We saw how it affected elections in the US, you know, so it's real. So it's not just, you know, we shouldn't just characterize, you know, the people behind this, and we could explore why, but I don't think we've got enough time, you know, to answer that question. But it's not just, you know, people who can be classified as nutters who are doing this, or people with, you know, hoping to spread mischief. We're seeing doctors, Bevan, medical experts, which, you know, Health 24 has been looking at. My question is why? I mean, I find it hard to understand that you know, doctors have been you know, behind some of this, whether it be ivermectin, whether it be, you know, anti-vax. What have you been finding?
Look, I think that's a very good question, and it's actually quite hard to answer, because you have to question what's the benefit of doing something like that, and what immediately comes to mind is that you are insulting and disrespecting your colleagues who are on the front line every single day fighting this virus, and consequently the disease for many people, and people are putting their lives at risk to fight you know, while they're treating people. It's just yesterday we had a story from our colleagues at Spotlight about the emotional and physical and mental toll that's being taken on health workers, right? And you can't actually quantify it, because they don't get a break. They don't get the luxury like we do of being able to work from home. They've got to be on the front lines all the time. So it's quite disrespectful and quite insulting, I think, to your colleagues who are fighting this virus. The question of why, it is difficult. I don't actually know. I think it's a lot of the times it's okay, I have a view. I should have people hear my view. But in the midst of a pandemic, you know, is that such a good thing to do, right? I mean, you should be guided as a doctor by the science, and what does the available science say? You know, vaccines are safe. Vaccines are our best chance to put ourselves in a much better position to not get severe COVID, not die from COVID-19, and that's what the science points to at the moment. So why they are going against the established science is very difficult, I think, to answer. But the fact is, and you're absolutely correct, it is happening, and it's not just one. There are quite a few, and you do see this on social media, be it you know, on vaccines or contentious things like ivermectin and some other treatments for COVID-19. So I don't think there is a straightforward answer in terms of why it's being done. But what I will say about it is that it's problematic. It's certainly very disrespectful and insulting to the doctors who are on the front line, who have a ridiculous amount of respect for, because it can only be so difficult. People are dying every day, and these doctors are seeing people die every day. Their colleagues are dying every day as well. So it's taking their toll. So, I mean, we prefer it doesn't happen, but unfortunately, social media does give people the specific outlet to, unfortunately, spread their views.
Okay. Nathan, as someone who directs editorial coverage, in charge of, you know, GroundUp's editorial coverage, and it's giving leadership to that. You know, coming from the media, because I think that the communication happens a lot in the media as well, both on our platforms and reporting on what people are saying. You know, the general rule that governs, you know, the media is, you know, right of reply, and if there are, you know, several number of parties involved in a story, you give sort of equal weight to their arguments. But there was something that you said, which really changed or you know, struck a chord with me, where, you know, in a piece you recently, I think, co-authored, saying that, you know, if someone says the world is flat, you know, you don't give that person equal amount of coverage, you know, when someone reports that the world is round. So then you go and look for someone who disagrees with that, when the science clearly points to the world being round. You know, what has it been like leading editorial coverage during a time like we face at the moment, specifically around, you know, contestation around, you know, vaccines and the use of vaccines?
So, I mean, I don't think the rules have changed. It's just that a scientific fact is as important to respect as any other fact. If someone had to come and say to you, Nelson Mandela is still alive, I want to write an editorial saying that Nelson Mandela is still alive, you'd laugh at them and say, no, we're not going to publish that in News 24 because it's nonsense. It's not a legitimate debate. If someone comes and says that the COVID-19 vaccines don't work, it's exactly the same principle. The science has shown unequivocally that the vaccines work. You might not understand how that science works, or it might be complicated or whatever, but there's, just as it's complicated that to explain to someone that that the earth is a sphere, that it isn't flat, or that the earth goes around the sun. It's certainly not obvious to people that the earth goes around the sun. We have to rely on scientists to tell us that. But if someone comes and writes an article saying, actually, the sun goes around the earth, we're not going to take it seriously, because we know that scientists have established beyond any doubt that it's the other way around. And it's the same thing with the COVID vaccines, that the science is absolutely unequivocal that these vaccines are very effective. Whether they'll still be effective against variants a year or two from now, or how long the efficacy lasts, that we don't know yet. But we know that for what's going on at the moment, and for at least several months from now, the vaccines that we're having now will be effective, and that can save many, many lives now. And that's the message we've got to get across. And so I don't think there's any change in journalistic ethics or principles as a result of the epidemic. It's the way we would have always done things. We just, the consequences of doing it wrong now, as some publications have, the consequences are deadly.
Tammy, just coming to you, I mean, talking about the impact vaccinations have had. You know, you're in the Western Cape. It's currently the epicenter of cases. Moving on from Gauteng, we know that cases, have been rising in KZN as well. But there was an interesting, the developments in the Western Cape, where the first two waves. A lot of, as you mentioned, a lot of people were dying. You felt like you couldn't keep up. Now imagine the clinicians and the doctors and the nurses who themselves were getting ill. Now we're seeing that not as many healthcare workers are getting ill, and that's helping people. The people who save our lives, and so we're seeing a real impact. Again, it's not just scientific data being trotted out, but we're seeing real impacts on the ground.
And I think especially because our healthcare workers were among the first to be vaccinated, that in itself should tell you a lot when it comes to whether or not you feel you need to be vaccinated. I think I keep thinking about people that say, that we're driving agendas and we are not telling the full story, just referring to what you said earlier, Nathan, we as the media have the responsibility to inform, okay? That is our job. So whether you want to read the story or not is up to you, but I always hope that you do, because the information that we bring you is the facts. Okay, we don't come with conspiracy theories or cover-ups. That's not what we do. It makes no sense for us to do it. But, it's words from the scientists, from the experts, from the hospital staff who are, working on the front line, from the people who work among the infected and the dying. It's the experience of people who come close to death, who see unvaccinated patients filling their wards. We explain and break down for us the science of what lay people like you and I maybe don't understand. And what I understand is this, what I've understood is this from medical staff, from people that I know that have been vaccinated. The current COVID-19 vaccines are not a guarantee that you won't contract the virus, but the chances are so much lower that you will contract it, and it decreases the possibility that you will end up in hospital or die. I think it's a bit, I don't know how to explain it, Salika, but the thing is, the hospital staff were the first people, obviously, to benefit from this vaccine, and a large majority of them actually went for it. The pros that we've heard from the experts, and that the information that we've got from people who obviously have access to all this information, it by far outweighs the cons. And I can just understand, or I can just imagine the frustration of someone that a hospital, somebody that works in a hospital, a nurse, a doctor, whoever, the frustration that you probably feel when you see all these people coming to your facility, knowing that there are options for them. You see people dying. It's disheartening. It's frustrating. It's sad, and it doesn't have to be that way. So, why are we not pushing harder to inform people so they can make informed decisions? Informed decisions are so important. If you say that you're not going to take the vaccine because of X, Y, and Z, what proof do you have of your theory? Or are you just throwing around sort of wild allegations that is in essence going to affect the next person, whether they want to get the vaccine or not? It's dangerous sort of territory that people are venturing into without thinking of the repercussions. And I mean, the repercussions is what is felt by doctors and nurses, the cleaning staff, everyone who puts their lives at risk to go and work every day at the hospital, all because you didn't do or take the opportunities that were available to you.
I think that's very important, and I mean very real as well. And that's a lot of what I'm trying to drill down to is the real impact. What are we seeing that's for real? Because yes, there's the science that's put out, and as Nathan mentioned, we may not understand the scientific terms. You may not understand what people are talking about when it's mRNA and is it protein based, and you don't understand this. And I'm going to turn to a question which I think speaks to some of the questions people have, and let's take the first one. It's from Shirley Brooks. Shirley Brooks asking the panelists, and I think this speaks as much to the media framing of the virus. Bevan, I know today we were having a discussion around international reporting, and you felt quite strongly about the framing of it. So let's go to Shirley's question. Shirley says, I want to ask about the phrase breakthrough infections, which is what they are using in the USA. So this is clearly what terminology Shirley Brooks has come across, and she's saying that, look, surely this is misleading. As you've just explained, having the vaccine doesn't stop you getting the infection. It gives you protection from severe disease if and when you do obviously get infected. Breakthrough infections makes it sound like something has gone wrong when it hasn't. Bevan, let's start with you. I mean, what would your response be to Shirley's comment?
I think Shirley has a very good point. What I will say to it is that the scientists themselves is not necessarily a media term. The scientists themselves use the term breakthrough infections, which is an infection after full vaccination. And also, I can tell you that specifically with the Johnson & Johnson vaccine, because we spoke to some of the scientists involved there, it's normally about 28 days. If you are infected 28 days or more after being fully vaccinated. So they have, that term is used by the scientists themselves. I have to agree with Shirley. It can easily feel like it has negative connotations, like something's gone wrong. But no, I mean, it's not gone wrong. In fact, the scientists do track. They want to see, how many people do get infections after being fully vaccinated, and also what happens to them. And this is why we can safely say people who have been infected after vaccinated are not dying. they are avoiding long stays in hospital or being hospitalized at all, and speaks to the safety of the vaccines. But I do agree that Shirley's got a point that could potentially be taken the wrong way. I don't think that was obviously the intention, but I will say that from people we've spoken to in terms of scientists, that is the term that is used. So not necessarily a media term from what I know of, it's being used by the scientists themselves.
And I think, Bevan, that is a really tangible example, I think, for all of us to take away in terms of how we think about people who, let's say, for a general way of describing it, haven't received the vaccine, haven't been jabbed as yet, are hesitant to get the jab, as opposed to resistant, because the terminologies may make people feel uncomfortable. And I think the communication around this is so key, as much as it is from government, but also in terms of in the media, how we explain those terms. Shirley Brooks now knows, and her gut is telling her, that I'm uncomfortable with that term. But she now knows that, what that term means, and how and that it's quite innocent, in fact, and it's a scientific term, and it's known within the scientific community. But our job is then to take it beyond that, whether it's as journalists, whether it's as marketers, whether it's as government communications. It's about making the information as accessible to people as possible, because I think that then takes care of a large part of the hesitant group, the group that doesn't understand the science and may well be a bit more hesitant to get that to get the vaccine. I think let's move on from a second comment, and I think this speaks to government communications, the strategy in terms of getting getting it out there. Shirley Brooks as well saying that, look, a further question from her is, people don't trust government, and for very good reason, and it'll be very difficult to disagree with Shirley on that. In terms of the greater contextual South African socio-political landscape, it's very difficult to trust government, for various reasons. We've got the PPE scandals as soon as COVID hit. We've got, state capture, which is just the inquiry that has ramped up. And people may say, well, why do I believe government? Why should I? What impact does that have on, the distrust of the state in terms of seeding the message, Nathan, that vaccines are safe? And obviously government is driving this because as they well should. It's coming out of the National Health Department. Government is procuring the vaccines. A lot of people rely on the state in a country like South Africa. How much of an impact does government distrust have in that vaccine hesitancy, in your opinion?
Well, let's the most important example, of course, is the money that government put aside for communications. Was probably the biggest scandal of all, the Digital Vibes contract, which resulted in the resignation of Minister Zweli Mkhize. That money that was the result of that corruption scandal, that was the money that was supposed to be spent on convincing people to get vaccinated, to wear masks, to adhere to physical distancing. And now, with that money gone, it's left to organizations like News 24 to communicate to people what they should do. That's the tragedy of the Digital Vibes scandal. But look, at the same time, I don't think we should be too pessimistic about the state of vaccine hesitancy. Most of the surveys suggest that most South Africans do want to get vaccinated. The fact that we've still got such a long way to go suggests that vaccine hesitancy certainly is a key problem, but I don't think it's the only one. I think there are problems that people are having accessing vaccination sites. There are people might not be able to go to the vaccination sites. Maybe they just don't feel, maybe they just need the little extra bit of motivation to get vaccinated. And for that, I don't think you can solely blame vaccine hesitancy. We've got to get government to be more imaginative about how it rolls out the vaccine program.
Tebogo, but building on that, and I think as Nathan said, look, let's look forward. Digital Vibes has happened, PPEs have happened, our slow start of the vaccine campaign has happened. There's nothing we can do. Looking forward, though, what positive signs are you seeing? We saw the Transnet train, which is going to, as you spoke about, go to rural areas where they may not have easy access to these big sites, the Gallagher estates and clinics and shopping centers and the like. We know now weekend vaccinations are a thing. We're moving on to a new cohort. What positive signs are you seeing?
I think one of the most positive signs is that despite digital vibes and all of those things, the Department of Health for the last couple of weeks has been a bit more open, with the public by having the Friday briefings, which are broadcast live, where the minister and other officials take questions from the media. I think that is a first step in showing the public that they are open to show that vaccines work and all of those things. And another thing is that, people are interested in taking the vaccines, and we'll just have to wait and see in the next couple of weeks to see if they really will go to the vaccination sites. But speaking to people like Dr. Nicholas Crisp, you realize that government is seeing the gaps that are there, right? So now they are working on taking the vaccines to people's workplaces. They're working on taking the vaccines to taxi ranks. And in Limpopo, yes, the MEC is saying that they want to start taking vaccinations to local taverns, local shebeens, local liquor stores, because and her argument is that this is where young people congregate. And if young people congregate there and they're always complaining once alcohol is closed, let's go to the places that they go to and vaccinate them there. So I think, those are some of the strategies that might work. And Dr. Chris was also speaking about how they are going to take the vaccination drive to universities and TVET colleges. If you get the bulk of the young people who are in school, that's the only way that we'll be able to vaccinate large numbers of people.
Tish, I warned you that we wouldn't have enough time to unpack this. 7 minutes for us to go. I think there's still a couple of important issues that I'd like us to get to quite succinctly. Bevan, you're a man who works a lot with studies. Studies out of health journals. You help the public understand. In your opinion, where's the shortfall happening? Because I saw this, I saw the statistics that Nathan is referring to, saying, there's a high percentage of people who want to take vaccines. When every cohort opens, we've got a sharp peak, and then it drops off. Where is that gap between people saying they want to take it and people actually taking it?
Look, I think we've touched on it. Accessibility is an important point, and also the fact that many people work. It's hard to go during the week, and in terms of what's available in terms of open sites on weekends, it's limited. Not everybody can go on a weekday. There is a want to go, but you can't always go during the week because you have a job. Many people who want to go are they breadwinners, or they don't have the luxury of. Many of us have actually been very fortunate. We've had the luxury of being able to go during a work day, where a lot of other people can't actually go. And so you try and go on a weekend, and in your area, there's a site that they're on sites that are open, or they're very limited sites that are open on weekends. So I think the accessibility thing is a big thing. And when I looked at the study that was released yesterday, which basically said that's quite problematic in terms of men as well, because where you find that in terms of overall acceptance and willingness, it's actually quite high in men. We're not seeing that being translated into actual people, men specifically, pitching up at vaccine sites. And what the study authors actually mentioned specifically is accessibility as a concern. a lot of these people are breadwinners who do not have the luxury of being able to go during the week. So what do they do over weekends? You know, so potentially in terms overall of what government's doing and also private sector, there needs to be that accessibility over weekends. I know it's hard because resources, you've got people who are working at the sites who are working very hard during the week, and you can't always get people to work over weekends. I know that's tough, and so that is a consideration. But sites being open on weekends will make a big difference, I believe.
You know, this period has you know, I constantly have to remind myself of my privilege being based in a major center with easy access, as you mentioned, the privilege of a job that, you know, allows me to go out during my work day, communication that is geared toward my first language, which is English. Therefore, I'm easy to, you know, it's easy for me to understand. I think it's Kathy Berman, in fact, Nkosinati Dlamini, saying, why is the majority of communication from this government in English? As a non-fluent English speaker, it's difficult to follow the morning briefings. And I think that's a very real topic. Nathan, I'm going to throw this one to you quickly because it intersects with the rural communities as well. Your team has done a lot of great work showing, you know, just what is the nature of vaccines in those rural areas. We focus on Johannesburg, we focus on Cape Town, you know, the major cities, but we forget there's a large sector of the population that are in rural areas, one, and two, who don't speak English as their first language, trying to make sense of scientific terms.
Yeah, you know, it's a good point. And all the points you made about the privileges that we have, that we just assume make it easy. And I'll be honest with you, Sheldon, I mean, I've considered myself to be quite on top of this epidemic, but if you had to ask me now, what's the closest vaccine site to you on Saturday or Sunday? I've got no idea. I'd have to spend probably about a half an hour searching on the internet to find it. You know, you can't expect people to just almost do that. In the rural areas, what you need is for government to send Department of Health cars or mobile units from door to door, explaining to people why their vaccine is important and offering it to them right there and then. Not so that they have to sign up to the EBDS system when many don't even have smartphones.
Tammy, you know, drawing it close to you know what you've been seeing in Cape Town, you know, there've been pictures about empty sites in areas such as Manenberg being you know, appeals from clinicians running those sites saying, look, we want people to come in. Again, you know, a lot of focus when we look at the sites that seem busy, you know, it's around Cape Town, it's more populated. Again, you know, the privileged class around the, you know, what are some of the stories coming out of areas like, you know, Manenberg, appeal for people to say, you know, come through and get vaccinated. Again, areas where, you know, as we just mentioned, you may not be able to leave your job that easily during the course of, you know, Monday to Friday and go get vaccinated.
I think most of the people that I've spoken to in terms of being hesitant to get their vaccine, majority has been because they have listened to conspiracy theorists. They believe that the vaccine is made of fetuses, and it's difficult to sort of pinpoint what exactly it is that makes people afraid to go. There's lots of different reasons being cited. There's people that say it goes against the religious beliefs. There's people that say that the famous Bill Gates conspiracy theory, you know, and that is why communication is so important, especially in people's mother tongues, like the Miss Lamini said in a question. I mean, what is being done to debunk these myths? It's not, I mean, we have the responsibility, yes, as the media, to spread and to give people proper scientific information, but there's so much. Not everybody is in News 2014. I mean, a lot of people are, but not everybody is in News 2014. So what are we doing to sort of further the facts of this is what is in the vaccine, this is why you should take it, this is why that WhatsApp message that you're forwarding is absolute rubbish. You know what, the communication part and the aspect and speaking to people in a language that they understand that speaking to them on their level. I mean, my level is pretty basic because I'm not a scientist, you know, but reading and spreading responsible information, I can't stress that enough. I mean, you have a responsibility to tell people the facts, not about nonsense about fetuses in your jab. You know, it's again the communication thing, which is why digital vibes are such. It was. I don't even have the word to say what an absolute mess that was, but that is why we needed to have people out there explaining why you need to go for that injection and not focusing on the minister and the waste of money which could have been used to save, in essence, people's lives.
Tammy, moving to you, Tebogo, we're speaking about a lot of what's wrong. Tomorrow, you're covering an interesting briefing. Now, when we mean fourth wave, no, we're not talking about the fourth wave of infections. This is around fourth wave of communications. Now, we know that there's been a group called COVID Comms who've been doing great work despite, some of the challenges that they face. And tomorrow they're having a briefing specifically around the communication. And I suppose a fourth wave of communication, which is so key in combating, infections as we head towards that, out of the third wave and, into a fourth wave as predicted later this year.
Yes, and COVID Comms have been doing really great work. They have really filled in the gap where government has not been able to do the communication. They have been going into communities. They have been releasing flyers in different South African languages, not only in English, but in most of the languages, so that people can get access to information in their home languages in terms that they understand. And tomorrow, while government is still busy with the third wave and with the vaccination drive, COVID Comms tomorrow is going to start their campaign on preparing us for the fourth wave. Because, when you speak to experts, they're saying that we are likely to have a fourth wave as soon as this very long third wave ends. So they're already thinking ahead to November and December when we are likely to have a fourth wave.
Bevan, coming back to you, one of the questions that we've received on the chat from anonymous attendee, quite a long message, but I'll condense it down to the gist of it. Saying the question is, how can we trust a vaccine or vaccines? Because there's not just one type. How can we trust vaccines that have been developed so quickly? They point back to history and say, look, it took so many years to develop other vaccines that were, that we now use today and are deemed to be safe. How quickly, how can they trust a vaccine that was developed as quickly as the current COVID-19 vaccine was?
So when we've spoken to scientists about how and why exactly it moved so quickly, it's two things. They leveraged previous research and previous technology that was already underway for quite some time and sort of piggyback that, we can use that word, in terms of developing the vaccines that we have now. And also the one thing, and they've been quite transparent about it, and which has been so important, and this is always important in terms of medical innovation, is the funding. The world really got so scared in terms of what's happened with the pandemic and what's happened with COVID-19. All of a sudden, the scientists who have probably been struggling to move forward with a lot of their vaccine research, etc., have the funding that was never available. And that's so important. It's you cannot move forward in terms of research and it's with things like vaccines without the necessary funding. So where they didn't have this before, a lot of money is being pumped into research, R&D for vaccines. I think what's important to know is that there are scientists who are working on vaccines and in terms of COVID-19 who have been working with infectious diseases for years and years and years. This form of the coronavirus, COVID-19, SARS-CoV-2, and the disease COVID-19 is not the first. right? I mean, and infectious diseases have been around for a long time. And so we're actually, sort of working on the back of so much experience with experts who have been working for years in HIV, tuberculosis, etc. And this is one of the things that actually, if I'm allowed to, I actually want to come back to one of the questions you asked earlier in terms of trust in government. I think the concerns are valid that there's distrust, but trust the doctors. Trust these guys who, and we've been so fortunate and privileged to actually be able to speak to so many of our professors. We have world-class experts in South Africa. And as Health 24 editor and my team, we've been very fortunate and privileged to have access to these experts. And they are the ones who are also trying to bring this message across. And if you think about the work they've done with tuberculosis and HIV, they are trying to help people. And I think that's the main thing. No one wants people to get sick. No one wants people to die. Nobody wants a vaccine that's going to have 1 million side effects. I mean, they would stop it in a hurry. Let's just look back at what happened with Johnson & Johnson in April this year. How quickly they paused the rollout when there were 6 people out of nearly 7 million who had very rare blood clots. Worldwide, they stopped it. I think we need to trust the experts. If you're not going to trust your government, trust all the doctors involved who are putting in all the hours. And I think that's a really important thing that it goes amiss a lot of the times. And I know I sound like a little bit of a groupie, but it's the truth. They are fantastic, and I have so much respect for all the work they're doing.
Guys, before we wrap up, I've stolen us. We're out of the 10 minutes that I've stolen for us, because this has been such a rich discussion, and I imagine one that's going to continue developing as we see it go on. I'm going to do a shotgun take, answering that question that we had at the beginning of the webinar. Are we headed for a catastrophe? Having discussed this, having heard the opinions and takes of each other at the moment, in first 30 seconds, tell me, how would you answer that question? Bevan, let me start with you. Are we headed for catastrophe?
I do think catastrophe might be a little bit hyperbolic, as you did sort of allude to early on. But I think if we don't get more people vaccinated, we're going to struggle with this pandemic for longer than we should. And I think that's really what we need to worry about. Think about having to wear a mask all the time. Think about having to be in different levels of lockdown all the time. Think about every time you can't buy alcohol for 2 weeks. So as South Africans, we like our tipple, right? Think about that. There will more of those things will happen continuously for the next couple of years if you don't get vaccinated. So just think about your luxuries and your liberties that you're used to, and having to wait out 2 or 3 or however long of this pandemic if you don't get vaccinated.
All right, thank you, Bevan. Tebogo, are we headed for a catastrophe?
I think I'm a bit optimistic. I think that if we are able to counter the fake news that's going around, and if we were able to take the vaccination drive to communities and to people, we might be able to get out of this. We might be able to vaccinate the number of people that we need.
All right, Nathan, your take. Are we headed for catastrophe?
I don't really like to think of it in terms of catastrophes. I'd rather look at it as a problem that we've got to solve. And I think I agree with Bevan and Tebogo. I'm also quite optimistic. I think the worst is probably behind us. But our challenge ahead is, how do we get as many people vaccinated as quickly as possible? Because there's a good chance that 8 to 9 to 10 months from now, we're going to have to start needing booster shots for people who are already vaccinated. And so, we're going to have to turn around the circle again. Let's get the vaccine program rolled out and perfected now, so that it's much easier next time around.
All right. Tammy, you're the last one up. What's your take?
I am optimistic like the rest of my colleagues. I do think, especially us in our personal capacities as the media, as long as we keep pushing the truth and publishing the facts and making and giving everything that a reader or the average Joe needs to make an informed decision, I do think that for me, or I call it sanity, will prevail.
All right, there we have it from our group of panelists. And listen, let me not try and weasel my way out of the hard question. Are we headed for a catastrophe? I think I share the sentiments that I'm optimistic. I think the numbers, speak to the optimism. 8 million people is nothing to turn your nose up at. The 8 to 35 cohort, you step up now. It's your turn to do your thing. I think there's going to be great excitement amongst that cohort. I think the stories from the ground as well also encourage me. The old gogos in Gqeberha, as GroundUp have told us, who are saying, listen, it's safe for us. We've got high blood, we've got hypertension, we've got all of these things, but here we are in the hall. We've got the vaccine. Look at me, I'm fine. You need to do it too. And I think with impetus around, government plans, I think we will see that number going up. And I think for me, the most important thing is that we don't shout at people. That people, we acknowledge that people are fearful, that, they don't have all the information, and that it is incumbent on us to do that communicating, to help them understand what are breakthrough infections, help them understand the safety of the vaccine, for government to go to those areas, and for us not to focus only on the privileged set. I think with all of those efforts, the efforts of the likes of COVID comms, government news organizations as well, that we will be able to get those numbers up, hopefully get out of that third wave, to enjoy our own filled stadiums, as we saw with the Euros and some of the other tournaments overseas, people enjoying their summer holidays overseas. Hopefully that can be us this year. But it does mean getting down into vaccination centers, getting people into vaccination centers as well, drawing them in, getting those jabs done as well. Thank you for joining us here on News 24's The Editors Roundtable this week. Again, thank you so much for all of your contributions, your questions. They really have been insightful and have helped us have a richer conversation. Stay tuned to News 24 to catch up on this conversation if you may have missed it. And also, keep an eye out for our next editors table. And if you want to contribute, have your questions answered, it's as simple as signing up as a subscriber on News 24. You'll get a lot of great content from across News 24, Health 24, Sport 24, our sister titles such as You Magazine as well. And you'll be able to contribute and have your question answered and have your comment. Put it to us. Where are we wrong? You can put that to us next time at the next Editors Roundtable. For this evening, I'm Sheldon Morais. Thank you.
Thanks, Sheldon.